I was born in Mexico and I grew up in Craig, Colorado. Growing up, I did the housekeeping industry with my mom. I was 10 years old when I started cleaning rooms, helping her make beds. I saw my mom working so hard, but still struggled to even get her teeth cleaned. And I felt like one day I would like to change that.
I am first generation Ethiopian Eritrean American. When I was 7, I went to Ethiopia for the first time and saw some children who had been born with deformities or had injuries from wars, homeless on the street. And I just asked my mom how come they couldn't get health care. And she would just look at me and say, "Oh, Sophie, it's not that easy." And that really stuck with me. It's why I became a pediatrician for the underserved, and it's why I'm really proud to have gotten to participate in the Colorado Health Service Corps.
So Colorado Health Service Corps was really born and developed out of a need to improve access to care in underserved parts of the state. People that live in rural communities often live at great distance from many of the healthcare services they need. In our urban communities, sometimes the barriers experienced by people are more related to income and health insurance. And so we collaborated with non-governmental partners and with clinicians who have a specific interest in meeting the needs of underserved populations, and we work together to achieve those access goals.
As a pediatrician working in a safety net clinic, you go home every day knowing that you are making healthcare better and you are affecting the lives of people and children in your community.
Living in a small community, you know everybody knows you. I like to talk to them and, say, come and see me, bring your kid. And if they have any question teeth-wise, that does not bother me at all.
They really see you as more than just their healthcare provider. You become a part of the family. I know when I call some parents to follow up on labs or ask a question, you hear the kids in the background, "I want to talk to Dr. Sophie." And the parent is like, "She doesn't have time for you." And I'm like, "Put them on the phone. Why not?"
Now, my teacher does that.
I love it. It's okay, you're 4. You have time to figure that out.
That connection I have with my patients, it's so important to me. I work with a lot of patients that never had their teeth cleaned. I had patients say, "I always have to go like this when I want to smile," and now I'm like, I can smile. I get tears and it just makes me really happy.
We have about 800 clinicians in our program right now, and more than 2/3 of the clinicians end up staying in the communities that they serve. And so we know that just in terms of the output of those clinicians, that our impact has been substantial.
The patients that we serve come from really diverse backgrounds, ethnically, racially, religious, language. What I think many of them are looking for is that we can connect along those lines. I have a lot of East African patients who come to me specifically because my family heritage is East African.
There's just a lot of Hispanics that they're so scared of going out there and maybe getting people that don't understand them. I feel like me working here, the Hispanic community is taking better care of themselves, not just health-wise, but dental-wise as well.
As a woman of color, I understand what it means for patients to be able to see themselves in their physician. I know where they're coming from, so I think that closes that trust gap. So this is a note I received from a high school student after presenting there about becoming a pediatrician. "You are unapologetically a Black female doctor, and I aspire to be you." That's really cool.
It's so important to have diversity in healthcare because our communities are so diverse.
The quality of clinical care improves, and the health status of people improves when patients have a range of options for clinicians. And sometimes patients are more comfortable with clinicians from a similar culture or similar racial background. So there's a real potential here for improving quality and access by improving the diversity of the Colorado Health Service Corps.
I always knew I wanted to serve this population. The big question was how to do that and pay off all my school loans. And the answer was the Colorado Health Service Corps with their loan repayment program.
We reduce the burden of those student loan payments and that long-term debt so that they can follow their passion. We've really created a win for both access to care in those communities and a win for that clinician.
It made a big difference on me and my dreams, It was such a nice opportunity, and I'm so grateful, honestly.
The best candidates for Colorado Health Service Corps have a spirit of service, a deep desire to meet the needs of people that experience high barriers to healthcare services, and they're likely to have a successful integration in the community that they're working in and stay long past the time when their state contract is concluded.
If you're someone that wants to make a difference, you're needed here in these communities all across Colorado.
For anyone interested in serving this patient population, you should really consider the Colorado Health Service Corps. Bring your diverse backgrounds and experience to the Safety Net Clinic community and help better represent and better serve our patients.